As a psychologist, I get to see a lot of cases with regards to special needs children. Special needs, I mean intellectual disabilities, autism, or ADHD. Now, these disorders do cause significant problems in behaviors if not managed properly. The problem also exists in the social adjustment of that child. If you're just letting the child figure it out on their own, how to deal with the external environment, I suppose there are going to be a lot of behavioral difficulties that you're going to face, such as physical aggression, verbal abuse, even sometimes inappropriate touches. Now, these are certain things that are on the scale of problematic behaviors on the highest. Now, there's something that can be also little less severe, like the child being too demanding, the child being throwing a tantrum in the public, the child telling lies, or the child just not being independent enough to take care of their needs. However, when I'm talking about rehabilitation, because as a psychologist I deal with rehabilitation, these behavioral challenges can interfere with the kind of social skills development that your occupational therapist or your special educator are trying to do. So firstly, if your child is showing any kind of behavioral problems as I described, or you're facing any kind of behavioral issues with your child, such as lying, stealing, physical aggression, verbal abuse, being too demanding, not interacting in a proper manner, back answering, having problems with authority, even having aggression towards animals. So all these behaviors, if you notice in your child or anything related to these behaviors, consult a psychologist, a clinical psychologist first. Because if these behaviors are not addressed prior to you sending the child to any rehabilitation care, the child would have problems at the special school or the daycare where you are sending the child, and then the child would not be welcomed there because they would have safety issues. So firstly, I would advise getting your child some behavioral therapy, also yourself some parent management training, so that you can address those behaviors, however small, however big, in the upcoming years too. Thank you, and see you in the next video.